Hi friends, I am Dr. Apurv Mehra and I represent Team Conceptual Orthopedics here. Orthopedics is a surgical division. It is a branch where you need to understand what to do and more importantly what not to do. Most of us have anecdotal learnings during our residencies. We see things happen and that's how we start doing it. But Conceptual Orthopedics wants to break this barrier. It wants to teach you the classical and the correct ways. It also wants to teach you the recent advances, how they should be correctly approached. Where? In the OR. So what are we doing? We are going to do the recordings of the surgical things that we do, right from the basic placement of the CR, where to place it, how to plan your OR, how to drape the patient, how to do it exposing the required area, what are the important key points to be kept in mind, exposure layer wise, important reductions if we are talking about trauma. We are going to dedicate our Wednesday evenings for the same to present it to you. What we will do the recordings, edit them and present to you, and yes, our teachers, they will be there to discuss with you each step and solve your queries. Are we going to stop at that? Absolutely not. What we will do is, we will be telling you in advance that this particular case will be discussed on this Wednesday. So if you have X-rays to share to us, they are more welcome. You can send them to us and then those X-rays at the end will be discussed what variations in the current approach or reduction or fixation could have been done to get optimum results. So what are you waiting for? Get glued to Conceptual Orthopedics to improve your surgical skills right sitting at your room. Thank you very much.